On this episode, we will talk about if GERD gets worse after the sleeve. We'll also talk about carbonation and the myth of stretching your sleeve. And we'll also talk about if it's possible to get a gastric sleeve if you are on birth control pills. Hello, welcome to episode 191 of the Ask Dr. A show. I'm Dr Alvarez and from Endobariatric, and welcome to your show. And if you are new to the show, and if you are interested in weight loss surgery, and if you are interested in gastric sleeve, you might consider subscribing to this channel. And if you're interested in getting your questions all the way to me and for me to be here to answer your questions, you're more than welcome to do so. The way to do this is hashtag AskDrA throughout social media. That way we're able to look into social media with that hashtag, pull out those questions, add them here to the list, and I'll be more than happy to be here with you and answer them, in this order. All right, so let's go into the show. So our first question, and this is a very common one, is, will my GERD, my gastroesophageal reflux disease, get worse after the sleeve? And the answer is, I don't know. And the reason is I don't know is I really don't know your specific case. So there are a lot of factors that cause GERD, reflux, and in fact, up to 50% of the patients who are overweight have GERD. And there are several factors that may cause GERD, obesity being number one, previous pregnancies, a tummy tuck, increases intra-abdominal pressure, age. There are several things that you might be born with a hiatal hernia and may cause GERD. There are a lot of factors. What you eat, spicy food, stress, you name it. A lower esophageal sphincter that's not competent, so on and so forth. But the vast majority of the cases being because you're overweight and that is causing reflux because of intra-abdominal pressure. The idea is this, that once you lose weight, you have your weight loss procedure, you start losing weight, the intra-abdominal pressure gets lower and your GERD gets better. Now, there's key here. I don't know who's crafting your sleeve. I don't know who's performing your sleeve procedure, because there are a lot of details into that surgery, the surgery I focus on and I do every day. There are a lot of details that if you are not aware at the time of crafting this sleeve, yes, your GERD may get worse down the road. So it's very important you go to a certified specialist, you look into your doctor, the credentials, how long they've been doing this, what do they focus on, and once you feel comfortable, take the step. Because once you start losing weight, you get a well-crafted sleeve, most certainly that GERD will get better or will probably go away. All right, second question is the myth. And we've done a specific video on this, I believe, talking about carbonation and like, for example, Topo Chico or carbonated beverages. Will the carbonation stretch the sleeve? The answer is no. But the carbonation may irritate your sleeve. So it won't expand it like a balloon. It won't make it wide because of the carbonation, but it may irritate your sleeve. And by irritation, I mean the inner layer of the stomach being irritated, may cause gastritis, may cause other symptoms if you overdo the carbonation, or if you overdo some other things. Like, for example, maybe if you overdo caffeine, may happen. If you overdo alcohol, it may happen. If you overdo smoking, it may happen. All these issues with a sleeve or without a sleeve will irritate the inner layer of your stomach, with a sleeve or without a sleeve. Now, with a sleeve, imagine yourself a tinier stomach, smaller stomach, and of course it flares up. That is the inflammation I'm talking to you about when I say carbonation may irritate the sleeve. And our third question for this week's episode is, I'm on birth control pills, can I get surgery? Can I get weight loss surgery? Can I get a gastric sleeve? And the reason she is asking this is there is a direct relationship with taking birth control pills and a higher risk of developing blood clots. Now, in our practice, since we're a center of excellence, we are obligated to go the extra mile to prevent, on each patient, prevent and go the extra mile to avoid a blood clot. So what do? Well, we do routine labs before surgery. We check your the way your blood clots. We check how fast it clots. We'll check. We'll do a low molecular weight heparin, which is a blood thinner to prevent blood clots. We'll also check. We'll use leg compressions. We'll also be using that air massage system during surgery to massage your legs during surgery while you're under, even though it's about 25-minute average surgery, very short surgery. And then again, you'll have those things in recovery, massaging your legs, and the first few hours post-op in your room. So all these factors add up to prevent a blood clot. Now, taking a birth control pill, can you take it? Yes, but in your specific scenario, in your specific case, anything that you might take, run it by your doctor, your surgeon, who you're looking into having surgery, and see what he or she says, because there might be other underlying conditions in your situation that may require for you to be off the birth control pill prior to surgery for a certain amount of weeks and after as well. So touch base with your doctor. All right, guys, so that is it. We're wrapping up actually episode 191 already of the Ask Dr. A show. Thanks so much. If you like the content, leave me one of these. Very useful. I appreciate it. And again, you're welcome to subscribe to our channel if you're interested into weight loss surgery or gastric sleeve content. That's what we're here for. Hey, send me your questions. Ask Dr. A, hashtag Ask Dr. A. I'll be here for you. Take care.